Okay, well, welcome back. Welcome back. Thank you very much. And just I think we're bringing back the live streaming. Welcome everybody coming in virtually. And yes, we had a break after those showcases, which was really excellent. And if I could introduce Usman, who's going to take us through the annual report of Council copy, which is on the tables. Thank you, Usman.
Good afternoon, everybody. Good morning, everybody. It's great to see you all. And now I have the fun job of presenting the annual account, something I know you've all been waiting with excitement for. So I won't go through all of the numbers that are on the pages. You'll be able to read those as well as I can read them out. But I thought it would be just good to give you some sense of what does it all actually mean. So I guess just to officially say, we finished the year with a £22,000 surplus against our break-even plan. So on £542 million turnover, that was bad. But I guess it's what does all of that actually mean? And you know, we've got up here all the accounts that we did. Brian's over here, our audit partner. We work really well with them. We've got a clean, sort of unqualified set of accounts. So all of that is kind of part of the core. But this is the stuff I kind of wanted to just spend a bit of time talking you through. So I think it's fair to say that everybody, hopefully, in the room is aware that it was a pretty challenging year for the NHS, especially when it comes to the money. Not that was the only challenge, but sort of from what we've heard about at this point, we were included in that in terms of the challenge. But we worked really effectively together, both internally as an organisation, but with our partners as well. And I'm really happy to see some of our partners here, voluntary care sector partners, some of our ITB colleagues are here too. And working together is how we got to our break-even position, because halfway through the year last year, we were looking at one point like we were going to end the year in about £20 million deficit. And that was early on in the summer. We identified that. We worked internally, we set up a series of programs to figure out how we were going to try and manage that. And we worked with our ITV colleagues to understand what other opportunities we could avail ourselves of to help try and mitigate that. So the fact that we ended up in a break-even plan is an absolute testament to the work that everybody in this organisation and across frankly Sussex did, in our BTSC partners and with the ITB colleagues. And I think it laid the groundwork for this year. So we built on the success of what we did last year, and that is how we've come around delivering on some really big cases for change, some really big programmes of work that hopefully this time next year I'll be talking to you about in terms of the success of those programmes. But some really specific things that we did. So you will hopefully all remember from last year how I spent the year talking about how challenging our agency spend was. We had as a percentage of our payroll bill one of the highest agency spends in the country. And through the work that we set up last year, we ended the year being able to reduce that by over £5 million. We're on course this year on the back of the work we did last year to reduce our spend by £10 million. So given that 22-23, we were at £35 million agency spend, we're forecasting this year will be down to 23. And so the work that we did last year both reduced it, but also set groundwork and set the foundations for sort of that continued improvement. And it's not just about the money. I think it's really important to say that all of these programs, there is a financial benefit that comes out of them, but they are simply a translation of actually what has been the importance of focusing on quality. So we all know that if we have patients being treated by our own staff, they're likely to have better outcomes than being treated by agency staff, because we're able to invest in our staff, training, make sure they've got the right qualifications. And so that's been a really important driver. You'll also probably remember me last year talking about how much money we spent with the independent sector in terms of our independent sector bed usage. So in 22-23, at the high point, we were using over 100 independent sector beds, and we had over 35 people actually outside of the county, outside of appropriate out there placements. And again, that's a quality issue. It's not really a finance issue. It's we don't want patients hundreds of miles away from us. We don't want patients being treated in facilities that frankly we don't have as much control over in terms of what happens there. And I'm really happy to say that this year we ended 23-24 at 40 independent sector beds, and bar 1 or 2 clinical exceptions, 0 inappropriate out-of-area placements, and no one being placed out. And as a rule now, we virtually have eliminated the use of independent out-of-area placement. So there were some really great things that we did from a quality and patient experience perspective that translated into financial benefit as well. And that's kind of the work that we built on this year. So some of you will know about the cases for change we're working on in terms of rehab, in terms of dementia, and all of those are not really about money. They're about actually making sure that the best practice of care, the sort of evidence that exists in terms of how we should be doing things is being implemented, and the money and the finances will sort of flow out. I got taught very early on in my career in the NHS that finance is only ever a translation of what happens within an organisation. You tend to find high-performing organisations with great quality, great experience, also tend to have balance because the cost of fixing things, the cost of rectification is always variably higher than just doing things right the first time. So some really great positives from what we did last year. A couple of other things I guess I just want to highlight because as much as we spend time talking about the revenue position, we also spend a lot of time and money on our capital position and investing in those things that we know will make a difference. I'm really pleased to say that last year, having approved, so last year, I'll be clear, talking about 23-24, having approved the Coombe Valley Hospital business case, construction on that has begun, and hopefully some of you who will have come in today will have seen the team out there at the stand, showing the videos and the drone footage of that which is now being built. And hopefully next year we will be in a position we'll be really close to going live. But that's not the only thing we've been working on. We've been refurbishing all of our inpatient wards. I would love to be able to stand here and say we could do every single one tomorrow, but as ever, there are constraints. But despite those constraints, we've got a really effective program, rolling program of refurbishments, and worked with Langley Green last year. We'll be working through Millview, and we'll continue to work through the rest of our sites as we go through the course of this year and next. Health-based places of safety have now largely all been completed, and again, that's a really big program from where we were a couple of years ago. An enormous amount of effort has been put into getting those completed. And digital technology investment continues apace. So we were part of the GDE program, we completed that, and this year now we also have begun the work to replace our EPR, so our electronic patient record, with an hopefully even better one we have now. And for those of you who work here and have access to our IT systems, you'll know that we're in the beginning of our Office 365 implementation and rollout. And those are tools, sort of on one hand, they're kind of technology things, but actually what they're really about is how we work together more effectively, how we use those tools and platforms to collaborate, to reduce some of the bureaucracy and the administrative burdens that we sometimes have to place on ourselves, and hopefully these tools help again. So there's been lots going on in both sort of what are we doing to make ourselves a sustainable organisation going forward, and both from a revenue point of view and from capital development. And from this slide, we're just going to briefly touch on sort of what does that mean for this year. So this year we set a plan for an £18.6 million deficit, recognising the challenging financial environment, not just here across the whole NHS. That was the plan we agreed with our system, with our regional regulators, national regulators. And if we deliver that, then hopefully we will be able to access the appropriate support funding and then once again be able to report a break-even position. I think the thing that's really important there, and I know we'll talk about next year and we'll talk about a lot during this year, is the savings program. It's a really significant savings program. And I think as a whole organisation, we recognised last year that we do not want to be in a position where we have to make short-term salami slicing style changes. And so the whole focus of our program at the start of this year was, over a 2-year period, how do we become a financially sustainable organization? How do we move out of this cycle of every year having to find 3, 4, 5% cut? How do we actually just get to a place where we know that the income we get will fund the services that we need to provide? And that has meant thinking about, what do we do? How do we do it? And it ties in strategy work that Colin's been talking about, and thinking about what will we do over the next 5 years within those constraints, but also how do we make use of new ways of working, technology, and working with our partners, so that we are providing a great service, but not always in every single thing perhaps that we've tried to do before. And I guess I'll just end with a couple of other sort of notes along that way, which is we're thinking about our estate. We're thinking about how do we make sure we make most efficient use of our estate. So the fact that we're all sitting here today is a big thing, because last year we were at Swansea, and we've now managed to vacate ourselves out of that. Over the course of the year, we'll vacate the south end of that site, and then that will give us significant opportunity for us to think about the future of the south end of the Swansea site, and how we might work with our partners to make best use of that. We transferred the ownership of the Lindridge care home to a specialist provider, because again, recognizing that we needed to focus in on what are we actually here to do, and we were not probably the best place organization to be running that. And I think it's important to highlight that all of these changes that we've been making have not been led by the finance. I can promise you that. We help identify the framework that we need to operate in, how much money do we have, where are we efficient and where are we not. But the changes that we have been making have been led by clinical and operational teams. And I think that is, for me, the biggest thing that came out of last year was how we all came around and worked together. And that was sort of we highlighted that through the implementation of our new organizational structure. So we implemented our new divisions, and we invested quite a lot in terms of the clinical leadership of those divisions. And I think hopefully that investment, along with some of the investment in our housing teams that we're talking about today, has demonstrated that where we do still have to make difficult decisions around how we use our money, actually there's great opportunities. We still spend a lot of money. We still have the opportunity to invest. We just have to think about how we do it. I'm going to finish there. Happy to take any questions if there are some, but I will just end by saying thank you to all our staff, to all our non-execs and governors who we worked through, who were with us all the way through last year when we did have to make some difficult decisions. I know it wasn't easy for anybody. I want to thank all the staff who are actually delivering all of the change. I know it's not been easy, and I know at times it has been stressful and at times anxiety-inducing, everything that we're trying to go through. But we are making real progress, and if we keep at this, by the time we get to the end of next year, hopefully we'll be sitting here and saying we've hit our sustainability position. We can now focus on making sure going forward we're actually thinking about we've got the right services, we're investing in the right way. And I want to thank all our partners as well, because again, we didn't do this by ourselves. So we work really closely with our ITV and other ICS system partners. We work with the VCSE sector, and I hope that we've changed the way we work with our partners as well, and being really open, being really transparent, and recognizing that we won't always have all the answers to it, and we need to listen to and look to others who may have experience and advice to offer us to help us deliver this. So I'll finish there. Thank you very much.
Thank you very much, Usman. That's great. Well, I'm going to ask Brian, our external auditor, to come up, but I think you've got a slide to share. So again, there's a slide there. It's a formal part. Thank you very much, Brian.
Morning, everyone. So I'm Brian Clark, and I'm the audit partner with Summer. This is our first year of working with yourselves as the external auditors. So just our role is to provide assurance to the board and to the Council of Governors of the financial statements that you've got in front of you today. And so a couple of things to report to you. First of all, the audit opinion was issued on the 23rd of July in line with the agreed timescales that were agreed with NHS England. That's a stepping stone to get the organisation back to reporting by the end of June 2025, the 24-25 year. And having worked with the team over the last number of months, both teams in terms of the audit team and the finance team, no doubt we'll be able to hit that deadline for the year ended March 2025. The audit process from our perspective went well. Our thanks to Usman and Corin and Nikki and everybody in the finance team. We delivered in terms of the annual auditors report that went through the audit committee in the appropriate time. There was an unqualified audit opinion on the financial statements that are included within the annual report and accounts that you have today. So that effectively is an opinion from ourselves that the income and expenditure and the assets and liabilities at the end of the year are fairly stated. We are required under the NHS Act 2006 to provide a commentary on the VFM arrangements within the organisation, and we did not identify any significant issues or differences with those arrangements. The NHS Act 2006 also places on the auditor a range of other powers to report to either NHSE as a regulator or to the governors if there are other matters that the auditor needs to be brought to their attention, and there were no such matters. So very good year in terms of the outcome of the audit, and our thanks and appreciation to everybody who's been involved in that process, with the finance side and Dan's team in terms of pulling the annual report and the remuneration report together. So again, I'll be happy to take any questions at the end. Thank you, Sean.
Yeah, thank you very much indeed. That concludes. I just need to approve the annual accounts. I'm looking at my colleagues to give me the approval. Thank you very much. Council of Governors, it's going to be shortened because we want some time for questions. I would normally do this with Keith Johnson, our lead Council of Governor. Keith hurt his back during the weekend, bless him, so he's not able to come, and we're watching Keith a speedy recovery. So what I'm going to do is, as this is for the previous year, a review, just I'd like a few comments from a couple of people that were around in the previous year. I wasn't, I came in April. I'm going to ask Anna van der Gaard to say a few words. She's our Senior Independent Director and Non-Executive Director. And then I'm going to ask Rob to say a few words as a governor. You've been involved in some of the committees that we're looking at to improve the relationship with governors and get a better impact. But Anna first, please.
Shall I just stand here or not?
No.
Thanks, Sean. So we've heard the word challenging a lot today. And I think I want to just start by saying that running any NHS trust and running it well is a huge challenge, and it never ends. And just my brief reflections on the role of the governors in meeting that challenge is that our governors are, in Mel's words, our eyes and our ears. And certainly for the non-exec directors, you have been hugely important to keeping us honest, to having honest conversations about the things that you think are the most challenging. And I particularly want to thank Keith and Mel, who's sitting at the back there, lead governor. Mel, you were our lead governor last year, and Keith's been lead governor more recently, but you've been hugely important in keeping us honest, keeping us focused, and being our eyes and ears. So I want to thank you, all the service user governors, the public governors, the staff governors, the governors who are past and present. I want to say thank you on behalf of the non-exec directors for all that you have done for us and continue to do for us. You are valuable and valued and an important part of our approach to tackling these huge challenges. So thank you.
And thank you. We'll hear from one of our governors. Used to be a consultant psychiatrist, many years in psychiatry, so really pleased to have you.
Thank you, Sean. Thank you for the kind words about the role of the governors. I think we are constantly working on this and improving it. And since the changeover of personnel with Sean's arrival, one of the things that we've done is looked at the role of the governors and how we can work more closely with the directors to continue our role, holding everybody to account and supporting the trust in its incredibly important work. And Simon has led very helpfully a group called the Government Trust and Finish Group that helps to clarify the role of the governors and how we should do our job in observing the meetings of the directors and appointing new staff. And this committee has completed its work very successfully with a paper that clarified what we as governors are supposed to be doing and looking at whether we need more, whether we've got more people wearing the governor hat than we might need, or whether we should be able to use our own time as effectively as possible. We acknowledge that the role of the governor is not to actually do the director's job for them, but to watch and see how well it's being done. And that was one of the things that was very useful to clarify. So thank you to Simon, and thank you to the director body and the whole trust for everything that you do. I think that's all that I need to say, although Mel, have I missed anything else in terms of your role as a previously governor?
Just as an explanatory thing, because it conjoins what these two have been saying. The eyes and ears thing is something a non-executive director came up with and put to me and said, can you tell people you're my eyes and ears? And you know, you're a non-exec eyes and ears, so it's going forward. And so I would do that, and people opened and spoke forth much more. And then he used to call himself Mel's voice to the board. And so this way, the eternal governor question, how do I get the directors to hear this? It got answered, but in a very productive fashion. So it's something I recommend. It certainly works, and only with people who you feel comfortable working with. But it's great to see from a different perspective. It's great to see how much everyone all wants this. So congratulations, thank you, and cheers.
Thank you very much.
Appreciate that. Definitely. So we're coming to a close. We're going to have a question and answer session. I think let's see how it all works out. Is Jane and her executive colleagues will come to the fore? A couple of microphones, I'm sure. Please ask the question away. Chris, you're still here. I mean, there may be questions about our showcase, but you know, there will be questions on the finance or anything you'd like to ask. And question time. So, yeah. Would anybody like to go?
I thought I'd introduce them first. I'm Jane, I'm Chief.
You have me.
Good to see you all. Teresa Barnes, Chief Nurse. Good morning, Fiona Moosey, Chief People Officer.
Dan Charles, Chief Communications Officer. John Charles, Chief Operating Officer.
Thank you. And Peter Aikins, our Chief Medical Officer, is not here today. He is retiring in December as well, so he won't be here next year either, but we are in the process of recruiting a new Chief Medical Officer.
Fantastic. So, please, anybody want to be the first to go? Thank you, Naz.
It's Neil Blanchard, I'm Chief Secretary of SADFAM, which is a voluntary sector organisation. It's a financial question, because I'm always intrigued by how the finances work for the NHS. So you said, if you achieve your deficit position, you then get funded to bring it back up to a break-even position. Is that right?
Yes.
So,
So
yeah.
I'm conscious I'm conscious of being live streamed. Be careful what I say. Funding is getting recorded, so you don't need to worry. Funding in the NHS, it's fair to say, has never been quite as straightforward as it should be. But in effect, each organisation this year will set a control total. Okay, we agreed a control total, so a position that we felt we could realistically deliver based on the amount of income we had, service we needed to provide, and what gap potentially that created. We went through a challenging process, both with our local system partners, with our regional and national regulators, and then as a whole system, we agreed a position which is a deficit position. But because of the way central NHS funding works, they in effect are holding what they have called as the sort of deficit support fund, and on the basis that systems deliver their control totals, they then release that support funding, so we would be able to deliver a break-even position. I think it's fair to say there's been various models of how funding was shifted in the NHS, but for this year, that's the way we're operating in terms of control total. So for us internally as an organisation, we're working to the £18.6 million deficit plan. That's what we've signed up to.
We're getting a light model here with the microphones, but I think we're doing okay. Yes, please.
Rob Jackson again, Public Governor. One of the questions that has been a recurring theme within the Governor group for the last, well, couple of years really, has been concern for the situation about level of service available both for young people in CAM services and for people with neurodiversity issues. A recognition that the Trust are facing the same problems that are being faced nationally about the massively increased demand for services as a result of increased awareness, perhaps through social media, and also increased pressure on people's mental health, also caused by social media. I wonder if one of the needs that certainly that people perceive within the Governor group is to work as hard as we can to improve services, but that may involve collaboration with other agencies. And I wondered if you had any comment about how the Trust is managing that.
Thank you. That's great. And one of the main things about working with this executive team, I think most of you could give a good answer on that one, but I think I'll ask John to start the answer.
I think you do, let's read.
Thank you very much for the question. So I think there's a couple of parts to that. So one was around the challenges with our children and adolescent mental health services, and I think attached and similar is the demand around the numbers of people presenting with neurodiversity, and we see both of those in adults and children's services, but I think you're specifically interested in children. I think the first thing to say is, yes, it is. It's a really significant challenge for us. It's not one that's just local to Sussex. It's a national issue, as everybody will be very well aware. But it's also not just for within the NHS. So just last week, we met with our colleagues in East Sussex County Council who are experiencing all the same challenges that you just described within schools, within their children's social care programme. There are more young people referred for neurodiversity assessments than we can currently manage, and there are waiting lists. There are waiting lists attached to those, unfortunately. We're working very closely with our colleagues in NHS Sussex with a Sussex-wide programme around what changes we can make to all of our services that are delivered by all the NHS and social care organisations to support children and young people with neurodevelopmental presentations. your question, in terms of adults, I just touched on the adult piece. I mean, that is a similar national issue. And again, the same programme of work that we're doing with NHS Sussex seeks to take that forward. But I think it's important not to shy away from the fact that we are receiving more demand for those services than we can currently offer. We, of course, clinically prioritise people where they have comorbidities and they have need for mental health services as well. But it is an area of challenge. You asked the question around partnership working specifically. So I think you've heard today a number of examples of partnership working. You've certainly heard from Dawn, who manages some of our neurodevelopmental services, where we do work very closely with community and voluntary sector colleagues, social care, and other NHS providers. We're really clear, particularly in this space, we can't deliver this all on our own. And there's certainly a question to be asked whether we are the best people to deliver the whole of that pathway. So a multi-agency approach is certainly the one that we would want to continue taking.
Thanks, John, and thank you for the question. So without reiterating anything that John has said, I just wanted to touch on the piece around early intervention and prevention all the way through to the services that we provide children and young people that need inpatient admission. So part of the conversation that we were having just last week that John referred to with our East Sussex colleagues is very much around what is the joint work that we can be doing together in the early intervention and prevention space, as well as what is the work that we ought to be doing together for children and young people that need inpatient admission and the quality of those facilities. We heard Usman speaking earlier around the estate, and certainly my key focus is on the quality of the estate that we're providing care in. So the early intervention piece, right through to inpatient admissions for children and young people, and ensuring that the quality of the estate is equipped to be able to care for children and young people that need those services. Thank you.
Thank you, John, Teresa. If there's anybody else, please let me know. I'm going to do chair prerogative. I'm going to ask a question about complaints. So Dan, putting you on a little bit of notice about this. The reason why I'm going to raise it is it's another one, Bob, you reminded me. Council of Governors during the year were talking about complaints and our handling of complaints. There was a statistic a while ago that was indicating that we weren't responsive enough and we probably didn't have as much as a handle on our complaints management we should do. It's really important for governors and service users, carers and staff, that when you issue a complaint, it is treated very seriously. And that is our ambition. But of course, it's transferring the ambition into reality. Perhaps just give us, Dan, an update on how we're handling complaints.
Thank you, Chair. I think it's a really important issue, and how we respond to complaints, particularly when things have gone wrong for people, whether there's somebody who's used our services or whether they're a carer or a family member, is a really important test of your values as an organisation, and more broadly as the NHS. As the Chair said, this is an issue that we've been focusing a lot on over the last 18 months or so, and there are three key aspects to our work in this area. One is around timeliness of complaints, so responding to people when we say we would. Secondly, tone of voice, being empathic, being human, and sometimes that means as an organisation saying sorry. And then thirdly, clarity of content, so responding to the issue that people have raised with us, using non-technical language, using plain English, and speaking to people in a way that they will be able to understand and gets to the heart of the issues that they've raised with us. So a lot of focus on those three areas over the last 18 months. It's an ongoing improvement journey for us. We haven't cracked it by any means, and we need to keep focusing on it. One example where we made an improvement prior to the last 18 months, we'd met our own response time target 2 months out of 45 months. In the last 12 months, we met it about 10 months out of 12. So we've made real progress. We've made real progress on the tone of voice and the clarity of content. But that remains a focus for us both this year and looking ahead for 25-26.
Yeah, very good. Thank you very much. Anybody else? I'm gonna, we'll ask one more, and it's gonna be me. It's such an important issue. When we were talking about, we've heard the pressures that were under, the financial savings that someone was talking about last year, the cost improvement program. This year, we're working on a strategy going forward, transforming services, doing innovation work like Chris was talking about in housing. You know, this plays out on staff, and it's tough to manage this, but also we will do our bit to make sure that the finances are kept correct, and we do break even and we improve quality. It's a lot to expect, but we are expecting it, and it's just really looking after our staff. And for me, I just wondered, you know, for me as our chief people's officer, she's very good on this. I just wondered if you'd sort of let us know what the sort of plans are and how we're incorporating this, and particularly motivating staff going forward.
So we started last year, and I think it might be helpful to do a very quick look back to help lay the context for how we are looking forward. We started last year with a position that meant that we were holding a vacancy position of about 18%. And in our nursing, within our nursing profession, that's at about 30%. And I remember the CPO of the ICB saying to me, if you can get that number to not have a 3 in front of it, then that will be done for the year. But it was quite dire, because it's easy to talk about numbers. And I remember saying to Jane when we did a review that the issue isn't so much the recruitment, it's our inability to keep the people, it's the retention, and that played out in our turnover numbers, which also then means pressures on the people who are left behind, having to carry all of that burden in high financial and challenging times as well. So all of those things then naturally dovetail into staff experience. So we were in a position where we had high turnover, high vacancy, poor staff experience, and that's what we had to deal with. And we came up with an 18-month plan that we called our roadmap to recovery, and it was to refine. And refine was to look at what are the key things that we can immediately get into and try to resolve with what we have, our limited resources, and to try to fix that. And then retain. And retain was looking at our EDI plan, creating one, looking at our violence prevention approach, thinking about our culture and OD plan, because we didn't have an OD plan, and to create one to help people to see what that looks like, and then recruit, which was to look at a very number of interventions that we could use to recognize that Sussex, you know, Chris mentioned earlier, it's difficult in terms of housing a place to work and to live. So those were the 3 areas, and we had 14 specific projects tied into those 3. And I'm happy to say that 12 months on, we're in a position as an organization now where our vacancy is now reporting 9% from a starting position of 18% a year ago. Our nursing from 30 is now 14%, so we have half that number. And our medical is about 16 or 17%. We've produced a new culture OD plan that says that this is our promise to our staff members that they can look forward to. We have a new health and wellbeing plan. And so as we're going into 24, well, we're now 5 months into 24-25, what we are doing is doggedly following through on what we promised to do. And that will get us through to March of 2025, when we then launch the new strategy. And then we will make sure that our commitment and our promise to our people will come out of what we have said we will deliver to our staff members, our partners, and our service users over the next 5 years. So that's very much the direction of travel that we're taking.
Thank you for that. I hope you appreciated that. It's a good place to finish. Jane, thank you and your team for answering the questions. We have now one item left, which is close up. And thanks once again, everybody, for coming to our AGM, and see you all again next year. Thank you.